Hello, everyone. Good evening for those of you who are in India, and good afternoon for the Ireland folks. So, thanks for joining us today. I know, it's sort of a weekend before Diwali, so a lot of shopping and other commitments might be there. But despite that, for the sake of the profession, we really appreciate you being here. We had several other registrants whom we are expecting to join soon. So in the first chat session, so before that, let me first talk about very briefly about what is this all about. So this Saturday Night Chat is a new initiative by the Indian Occupational Therapist think tank to explore and brainstorm the issues that affect the occupational therapy profession in India. So the idea is during every chat session, we will come up with a topic and a series of questions for discussion, and we would like to, explore and discuss different perspectives and stuff. So our first session was held in the last week of August, and it was about manpower shortage in occupational therapy in India. It went well, and the recording is available on our YouTube channel. I will share the link in the chat box if you, looking for that link during the meeting. And today, for each and every session to moderate that discussion, we have one of the IOTT member, volunteering for that. And I did the last meeting's moderation. Today we have Dr. Suresh Kumar Kamalakanan, who is going to moderate the discussion. The topic is, in continuation with the last meeting's discussion, we would like to still explore what can we do about, increasing or empowering the manpower of OT in India. And I think I will let Dr. Suresh talk about the topic and the questions for discussion. But a couple of housekeeping things. Actively participate in discussion. The more you talk, more you share your perspective. And also, even if you disagree with someone, try to do that in a very polite and acceptable manner, and no accusation whatsoever. And of course, we all have our different opinions on everything that's going on. But let's not accuse, let's keep the atmosphere very positive. But again, constructive criticism are always acceptable, but don't point a person's name or something like that. In addition, please be aware that this meeting is recorded, and it's totally up to you to whether to keep your camera on or off. Also, if you want to share anything, please, maybe if someone else is talking, wait for your turn. Otherwise, put the hand icon. I will invite you to speak. With that being said, this recording will go, on our YouTube channel with the title. So by participating in this session, you're agreeing to that. I mean, you're consenting to that. So thank you so much. There is one more person. Let me admit it. All right, Dr. Suresh Kumar Kamalakanan, over to you. You can take over.
Great. Thanks, Karthik. And warm greetings to you all. I should say warm good evening to you all for people from India, and good afternoon to people from Ireland. We have a few people from Ireland and the UK. So last IOTTT Saturday night session, we had this topic on human resources, occupational therapy workforce development. What were the issues, how it is actually conceptualized, are there any real barriers to kind of improve the workforce quality in India, and what could be the potential solutions to it. We had good participation from lots of enthusiastic OTs in India as well as abroad. And currently we have in this particular meeting, we have about 7 participants, and of the 7 participants, I think we have Nidhi and Muthu
And we had a couple of more other. I saw Bharat Senti joining and momentarily and left. And there was another participant, Ramona. I don't know what's the exact name, but he or she just joined, and I don't know what happened. They left. Probably they're having some connectivity issues. So we could expect them to join soon.
No problems at all. Thanks, Karthik. So what I would like to start off with is by saying that last session from IOTT Saturday night on the same issue, we thought it was not completely discussed in terms of there are lots of scope for the discussion on the topic. And so last time it was, I would say we did discuss lots of things, but the way we thought was there are lots of more information that we need to debate on and discuss further. And hence we intended to actually have another extension of this meeting. What I'm going to do in terms of moderation is ask questions to you all in the floor, whoever is actually participating, and then probably I'll ask more questions to people from IOTTT itself on their perceptions and their kind of ideas in order to look at the gaps in occupational therapy workforce in India, and also to look at what could be the potential strategies and solutions. I will start off with the president of the organization, Karthik, to share his opinion about in terms of numbers or in terms of the practical burden. Looking at people who require occupational therapy services in a country like India, what is your thoughts and perceptions about the workforce that is available to manage the demands of those who need our kinds of who need occupational therapy services particularly?
Correct. Thank you, Dr. Kamalakaran. So I'm just, whatever I'm sharing is my perspective. Again, there may be some people who might align with my thoughts or disagree with me. But in general, some of you may know that I have conducted a series of workforce surveys, in the recent past years, in 2015 and in 2018 and all. So one thing that I noticed is the first issue is that, we are in certain pockets of India, but not widely distributed across India. So definitely, in my view, first, that may have service accessibility implications. So the services may not be available for people who are living in suburbs and rural regions. So that is the first concern that I had. And then also, if you really look at the workforce, obviously the therapist-patient ratio is very off. We know that we have, you know, as per the 2011 census data, we have like 2.6 crore people with some sort of disability, and definitely, if not all of them or most of them, would be appropriate candidates for occupational therapy. But there are a lot of barriers, between the people who need services and people who can provide services. And for that, one is the service accessibility issues that I just mentioned. We are not like widely dispersed in all areas. So even someone is looking for an occupational therapist, there is no OT in that area. And if you really ask why, then obviously, we are only graduating in certain numbers every year, and they are kind of like subsumed in the urban regions and in one certain portions of India itself. So we need to definitely produce more OTs or manufacture more OTs by having increasing the seats or having more colleges. At the same time, we also need to focus on the quality of education. Even like we may have 2,000 OTs, but how many skilled OTs do we have is the question that we should ask. And we need to really do a lot on skill development initiative side as well. So we need to look at the quality of education, the quality of the people who are graduating, and we need to see what other resources people have, the OT graduates have after they graduate, in order to improve their skills and all. But the bottom line, I always think that we need to up the manpower for several reasons. One, see, for example, right now we say ballpark we have 1,000 OTs graduating a year, and obviously the service need is on the growth. Unfortunately, either increase in the identification of people with autism or ADHD, or the actual increase in the conditions itself. But the pediatrics is one area where the money is flowing in. Obviously people want a job and want to make their living, so it is understandably that a lot of people are inclined towards going into the area of pediatrics. But my point is, if we have more, like say 3,000 OTs graduating, 5,000 OTs graduating a year, despite meeting these needs in pediatrics, then they will start exploring other areas. And that way we will also tap into all the untapped areas like ergonomics, neurology is the second most practiced area as per my workforce survey data. And also we have, a lot of cancer patients in India. So oncology rehab is something that is a very potential opportunity. We have a lot of elderly people in India. So that is again, now the culture is changing in India. A lot of people are, going to work. So they, previously the family members take care of the elderly, but the situation is changing, especially in the urban parts of India. So if you really look at all those factors, we have a lot more untapped areas. And in order to tap that, we need to have more people who's looking for a job or opportunities. And also, once you have more people in the field, then the conferences will have big attendance, and that is going to attract the vendors to come and support us, right? So it's sort of an additive effect, I would say. It's a cascading effect. So one thing lead to other, which lead to other, which lead to other. And when there's a lot of people, obviously the government attention, state or central, it'll be more. If it's a really big profession with a lot more people in there, then obviously they will try to accede to some of our concerns and requests and stuff like that. So in summary, I think that we definitely need to increase the manpower in the field of OT, and also we need to focus on quality education. And also, as I said, postgraduate education skill development opportunities should be increased, and we need to tap the untapped areas. So it has to be like both, like those who are already in the field must help the newcomers integrate into the field, and also we need to do some advocacy and policy level changes and stuff like that. But in like having said everything, in my strong view, for the past 10 years, the OT profession in India is on the growth trajectory with a lot more new colleges. So a lot of positive things are happening. If you compare the first 50, 60 years with the last 10 years, we are definitely in a growth trajectory, which makes me really happy. Thank you. And I saw Mani sir's hand for a while. So if you want to invite him to share his perspective.
Yeah. So I would basically like to wrap up this concept of saying that in terms of inaccessibility to occupational therapy services for the demands that we have currently in India, one of the concepts that you posed was related to availability. So inaccessibility is a bigger concept, and within inaccessibility, availability is only one part of inaccessibility.
True.
You have issues related to affordability, and you slightly touched upon something called quality, and that is also kind of an area where we need to delve into. So probably I will ask Mani sir to talk about how do you actually strengthen occupational therapy workforce appropriate to the needs and demands of the people who need our kind of services in India in terms of appropriateness. So we do have occupational therapists, but are they doing things appropriately? How can we ensure that the workforce knows what an OT should be doing ethically as well as effectively?
Thanks, Karthik and Suresh. I totally agree with Karthik's viewpoint on the lack of workforce. I'm slightly differing in an opinion in the sense that it's not necessarily the lack of workforce, and there is a supply and demand issue. For me, what is happening is the understanding of what the demand is probably not there at the moment. It is probably associated with the lack of awareness about what occupational therapists could do. I was in a meeting yesterday, and the moderator is a neurologist who was asking a question about how do you differentiate OT from a physio? And that's a traditional question that was asked by somebody when I was in India 20 years ago, and it is still the same. So it is quite unfortunate, and at the same time, I think that is probably where we should focus our attention to. It is certainly needed that we need to increase number of colleges, number of educational centers. Thereby, we are increasing the supply. But for me, the worry is I don't know. I don't have data to support it. But in the past, we've been actually producing people with the OT degree with the intention of sending them abroad. Apologies, I have done exactly the same. I graduated and I moved to a different country without serving to my country with the need and things like that. But having said that, I don't see a scope for me to go back. So I really want to go back, but I don't see a scope for me to go back. So in other words, what I'm getting at is, if we have, let's say tomorrow, if we have 200 additional OTs or 200,000 additional OTs, will we really have a work environment for us to be working? If we don't have it, then what is the point in developing a lot more of graduates? That's number one for me. So the second thing is, you were asking about, I really lost your question, Suresh. If you can actually go back to that question again, please. You are muted.
I was asking about the appropriateness of the available occupational therapy. So you did touch upon that point in terms of saying we do have people who are competent and skilled, but even if they think that coming back to India and then starting to help people with occupational therapy needs, is there a system in place for us to actually join and then do it as we do it in any other country, probably a developed country or even a developing country? You did touch upon it. My question to Murli now is exactly coming from both your viewpoints, Karthik and Mani sir. So Murli, Karthik and Mani sir are talking about one, lack of availability of services. Number two, about already, although there are some amount of people who are there in major cities in India, for example, to cater to the needs of population who require OT services in these cities, are they actually competent? And say, for example, I'm just posing a situation. I'm from UK, Karthik is from US, and Mani sir is actually in Ireland. If all three of us are planning to come back to India and then start working as clinical practitioners, do we have an environment in place in India? Or for example, in Tamil Nadu, context of Tamil Nadu, because you're from Tamil Nadu, and you're also part of the executive committee of All India OT Association. So what are your thoughts? Do you think there is a system in place to do things or provide occupational therapy services for people who need it ethically and effectively? Over to you, Murli.
Hi. Good evening, everyone. In simple terms, if I should say, there is definitely no system to cater this kind of need. Definitely, yes. Either to make sure the service delivery happens in a systematic way, or to make sure the quality of the therapist keeps going, or to maintain the knowledge level or the learning ability of the therapist, to keep them updated every year or so. There is no system as such involved. But what we would prefer is, since the councils are coming up, hopefully in near future, when the councils are coming up, there has to be a mandate of updating ourselves in many areas. As attached with the college, I would say the UGC requires you to publish certain research papers in a day, in a year, and keep you do professional developmental courses and like that. But the people who are practicing other than colleges, the clinical field people who have clinics and everything, we have never realized that we need to keep updating ourselves for the recent trends. That way, our quality definitely goes down over a period of time, because the technology and the science is developing, and then we are still holding on to what we have learned. And nothing wrong in holding on to the basics, but still we need to learn more and go ahead. As the association or the individuals ourselves, we have never kept this as a priority to keep a system in keeping ourselves updated in service delivery, as well as keeping the new coming therapist updated in the skill level. If you want the abroad people, the people who are there in the abroad, coming back to it, this is a very interesting point, because the whole system is going to be totally different for you guys when you come back in. Monetarily, will it benefit you? I have no clue, and I'm pretty sure that is going to benefit you less, way less than what you earn abroad, because there is no particular system. There is no comprehensive healthcare delivery system here. It revolves majorly around pediatrics. Yes, very few people have broken that stereotype of working only with pediatrics and then gone into do psychiatry and neuro separately, but that's like a very meager amount of people. That's what I would say. And these people should or would get involved in training processes, and only by sharing and training with each other, we could probably build a more skilled and competent therapist or the network of therapists, so that we will be able to sustain how we are working, at the same time serve the needy people as well. That's my point.
I know, Tim. Can you please? Yeah, I think. Am I audible now?
Yes, yes.
Great. Okay. So I'd like to basically reflect on what Murli had said in terms of training and skill building. But the question that I have for Karthik and Mani sir on it, and probably Jyoti Kumar from IOTTT, especially because he's someone who's always in a very niche area, which is not known to lots of people, but very clearly a place where he has actually got lots of updated knowledge and skills in relation to wheelchair service provision from an OT perspective. So I'll ask that question later. However, because Murli was actually talking about what is known is only related to training and skills, and he said we are expecting counsel. So I'd like to request from the audience, either Muthu or Nidhi or Naushin, what do you understand about this council from an OT perspective? Or what do you think you will benefit, especially as an OT, through this council? And when do you think this council is going to come up? Any thoughts on it, please? Muthu, Naushin, and Nidhi, please. Yeah, Muthu, please.
Suresh, can you please be specific, even more specific? What do you understand by council or the benefits of council? Can you please be specific a little bit?
Yeah, what do you understand by council, and how do you think it is going to help OTs, help you?
How does the council is going to help me as an occupational therapist? Am I right?
What is the council that Murli is talking about? That's the first question. What do you understand about it? What do you know about the council? And how do you think that that council is going to help an OT like you?
It is a centralized unit, one uniform unit having a uniform legislations both for practice, clinical practice, and for research. It is not like whoever can do whatever they want to do. They have to abide to one particular denomination, or as he said, a council per se or association. It is a nationalized council, as these people, MBBS or medical doctors, do have. So thereby we can expect some sort of decorum in our practice.
Okay, and how does that kind of going to help you in your practice, whatever you do?
See, I can be benefited both financially and professionally, I should say that, because having a council for my profession is indeed really, really great. Rather than saying, see, with respect to All India Occupational Therapist Association, it's not a matter of new thing I'm going to talk about. Say, for example, there are some handful of people are there since 1947 or something, even before the independence. Okay, so whatever, say for example, if I really want to change something, I really can't. That is I'm literally handicapped. And I just gave up. I don't know how many of you know about it. And there are certain people who work in the close circle with me. Once upon a time, I used to be closely associated with the Occupational Therapist Association, because most of the members in the higher position are my teachers with whom I personally worked with. So it was quite easy for me to convey the information to them. But sometimes, very sorry to say, even sometimes those people are also equally handicapped like you and me, because of their higher hierarchy. So say for example, if we have council which is nationalized for uniform council, we can at least have some sort of scope to put forth our personal or personal means professional whatever the problems which I'm undergoing. Say for example, a uniform standard of practice for that matter, which is the need of an hour, or the consultation charges. Say for example, if I move to Gulf countries or US or UK or any other Western or European countries, there is a standard fees that has to be recorded from the patient. See, for example, with respect to assessment or consultation or all such things. And second, most important things, what is the point of having the patient only for consultation without doing any sort of standardized procedures or standardized assessments? How am I doing justice to my profession, and who is going to ask me for that? And how am I, say for example, I'm doing that thing and there is no one person to ask me, and say the service provider is like this, but what happened to the client who is coming to me? Where the patient goes? See,
Right.
for example, see, you guys are there in European or Western, US or UK, whatever you call it as. There, say, for example, the client have 100% rights to sue you if something goes away. Even a millimeter it is going away from the track, you'll be sued. So the therapist is even more cautious and conscious. Duty consciousness will be even more great. This is what I personally feel.
Sure.
So we can definitely have the uniform standard of practice with not just with respect to practice, and also with respect to for fee structure or salary structure. It is on both sides. It will be benefited both for the clients and for the therapists or the professionals, you mean to say.
Thanks, Madhu. Thanks.
So just one thing, when participants, non-IOTT members, when you try to share your perspective, just first introduce yourself, who you are, where are you from, and in which practice area. Just 3 things like, I'm from Chennai or Kolkata, whatever it is, and then say what practice area you are in so that we get to know you better. Thank you so much.
Thanks, Karthik, for that. Thanks, Muthu, for kind of openly breaking out the egg and then saying that there's lack of accountability in what happens in relation to the council, and also how it will actually benefit. Even if there is a council, how will actually increase accountability for people like us, and then for people who want to come in and then work for us in occupational therapy paradigm professionally in India as well. Are there any other inputs from Naushi, Nidhi, or Pooja? We also have Gomati and Naresh here. I'll have Naresh parked for now. Any thoughts, Pooja, Gomati, Nidhi, on what do you understand by the council, and how do you think the council will support or strengthen the current existing workforce, OT workforce deficits?
Good evening, sir. Good evening, everybody. This is Nidhi here. I am a PG student from Coimbatore, Tamil Nadu. From the very little experience that I carry, I would like to say that the council is definitely going to regulate not just practice but education also. And as the previous speaker touched upon, the council will aim to regulate the monetary compensation that the professionals should be receiving for the various procedures that they carry out. So in my opinion, a council in place will actually help us increase the workforce, is what I feel. When there is a minimum standard of education and all of that, most students, young students, would be excited to look forward to OT as a good career, which has a good scope and all of that.
Oh, thanks, Nidhi. Are there any other inputs from Pooja or Komati? If not, if you have any questions for us to answer, or if you have anything to share, please raise hands, and then obviously I'll let you talk about it. The question that I had for Jyoti especially is in relation to what Murali and Mani sir were talking about on evidence and on skill building. So what is your understanding about the kinds of skills that an OT in India should possess? And do you think they actually have the skills of an OT, say in your context in Ireland?
Thanks, Suresh, for asking me this question. And I will introduce myself. I'm Jyoti Kumar Ramakrishnan. I'm working as a occupational therapist in primary care settings here in Ireland for the last 11 years. And I initially worked in India for the first 3 years. Now, coming directly to the question, and I would say from my very short time of practice in India, I would think that there has been more emphasis of OTs practicing in pediatrics. And whenever I look for any kind of training or workshop, it's more around pediatrics, which has been emphasized more. And I couldn't see any scope other than that. And when in comparison, and when we look about the scope of occupational therapists elsewhere, there are more broad scope. Take it as, even if you think about pediatrics, there is more on neonatal pediatrics and developmental pediatrics, and more emphasis on handwriting, and there are many kind of variants within pediatrics. But apart from that, and there is more scope on acute hospital, emergency departments, and rehabilitation, and child and adolescent mental health.
Correct.
And the scopes goes on. And also there is also scope building in more developed countries in terms of OT services in prison, OT services with the councils, where they are doing more work on housing adaptations to make everybody to access the environment in larger perspective, including public buildings, which is going to have a wheelchair access, which is accessible for all. And the scopes goes on. And if we put the same context in India, I think we have a large mile to go in terms of accessibility. So, and considering a multi-diverse country like India, I would say that we should more focus on improving our profession in different aspects, and also we should give a voice for the people who are differently abled and who are accessing wheelchair to have a better quality of life. So one of our occupational therapists service motto is quality of life. So, and that aspect should go beyond. So we are going to train a person to achieve a life skills. At the same time, the life skills should enable them to access all the services available. So if they think they have to go to a shopping mall or a cinema, they should be able to access that. One of those kind is about getting them to get out of the house and go to the community and do whatever they want like everybody else. So that is enabling them to have the independence and to have a quality of life and to live the life they want. And one most concept for that is accessibility. So no matter they are using a mobility aid or a wheelchair or any kind of mobility devices, or they need a dog for them to guide dogs to guide them. So the accessibility should be there and the provision should be there. And this cannot be done in a single day or by a single profession. So as my previous speaker stated, yes, the council should lobby for the entire community, the entire profession, and also should make a strong voice in the parliament and with the politicians to make our service recognized, and also to make the public be aware of using the occupational therapist to make them, enabling them in their functional aspects and the life.
Sure.
I
Thanks,
hope
Shruti.
I have clarified what you asked me, Suresh.
Yeah, certainly. So
thanks for the opportunity.
We should only thank you for those valuable inputs, Shruti. So you talked about appropriateness very, very clearly, and you also kind of connected the council activity and the availability of existing OT workforce to look at the scope that is existing in the country, and then provide what is exactly needed. So I am going to actually pose one question to somebody I know in this group who's a fresh but very, very targeted, effective OT, Benny, to basically explain. So when Jyoti had spoken about whoever is available in India. He said we have lots of OTs practicing pediatrics. And he also said the end point of any OT intervention should be improvement in quality of life, independence in whatever they are doing. Can you please say whatever is happening currently in your context, whether it's Bangalore or Tamil Nadu, occupational therapy pediatric specialists providing services for children with disabilities and or OT needs, are they trying to look at quality of life as the ultimate goal of their service or intervention? And if not, why not?
Yes, sir. So this is a really good question, but I don't think so whether this is the right age or this is the right time for me to answer because I'm just a fresher. So basically, I'll just tell you with respect to my context. So how I try working with the people, mostly with respect to the pediatric population. But when you speak about more about Bangalore, more of autism is what you get to see quite often, as well as few developmental delays. Not much of CP or Downs are available, but mostly ASD, ADHD is what I see. So when I speak about that, so majorly I put my therapy into 3 different columns. So left side, what basically I do is whatever the needs they have, let it be the sensory processing need or things respect to that. In the middle column, I basically put down the all the cognitive components such as listening, understanding of the child, learning, and how to develop the interest, mostly with respect to uh, mostly with the cognitive part. And the last part, what I put and work on is the 5 major things where I think is right to put and work. One would be ADL, second would be IADL, instrumental activities of daily living, the play, the social communication part, and last even academic is what I even work on. So these are the 5 things what I try to work on. And when it again comes to the population, I divide them into 3 basic categories. So 0 to 5, 5 to 16, and 16 above. So what basically I do is 0 to 5, I try again focusing on the major developmental part. So and focusing on the development of the child. So if they get streamlined to the normal or neurotypical child, how does a neurotypical child grow? Yeah, it would be easy for them to cope up at the later stages. So again, when you come to the middle stages from 6 years to 16 years or 6 years to 18 years, what basically I try working with respect to them is try building a lot of skills to them, teaching a lot of skill set to them. Example, I take the child to shopping mall. I tell them to get few things. I'll just make a list and give it to them so that they can bring the things and put it in the basket or something like this. Is what I basically work rather than I don't now as of now I don't work in a pediatric setup kind of thing, but I do a lot of private cases.
Got it.
So when I do that, I try working in this way. And even I take a lot of online sessions right now. Again, not only from India, also from few parts of the globe. So when I do that, even I try focusing more on the skill set of the child till the age of 16. So after that, what I would definitely do is whatever they are good at, like few people have started with vocational training sort of things, and as well as if they don't have the ADL completely worked on or again the ADL worked on, that is what I'm right now working. So this is how basically I work with respect to a population of pediatric. But when I see what to say, the major reason I don't work like other mainly the few of the senior therapists, again I'm telling I may be wrong also, but I don't know. So what I basically find it is when I start only working on sensory aspect, I don't know when the sensory is going to be fine, definitely. So there should be an age. So till 8 years, if I work on completely only on sensory, so after that, when I start my ADL or other life skill set, 8 years would be wasted for the child. So that is the reason what I do. I work on sensory also, but in the same way, I work with these sort of ADL, IADL, play, social communication, and academics also, sir. This is how basically I work. Yeah, sir.
Thanks, Benny. So, as an add-on, I'm just going to ask you another question, and probably anybody else can answer that. So, which is related to a situation where someone like you wants to move to another country, leaving India, and then start studying. And I'm not saying you want to work there and contribute to the economy there, but it's just an idea of youngsters finishing occupational therapy and then moving outside India for learning more. And when you talk about skills that you have and skills that you focus on when you treat your clients, and if you still have a need to move outside India to learn more skills, what is it that's available in our country as skills for OT?
Sir, one thing is, yeah, definitely there should be a lot of things, skill wise I'm looking, but more than that, like what I basically feel is my major domain or where I would love working is with respect to the vocational rehabilitation, sir. When it comes to vocational rehabilitation, I don't know whether I'm not much aware or I've not done much research, but what I basically felt by doing few researches, there is no as such a vocational rehabilitation center run by an occupational therapist in India, if I'm not wrong. So
I don't know. It's open to the other audience who want to actually open up. Yeah. Does somebody want to respond to Benny's thoughts and kind of either accept it or add on or disagree?
So adding on, maybe here.
Yes, Nidhi.
I feel that we need to be able to justify ourselves in many contexts. As we discussed previously, there is this traditional question: how do you differ from PTs? Especially when it is in PMR or neurology, orthopedic, etc. That is one question which is asked to us. Similarly, everywhere, all of us should be having that much of skills that we should be able to defend our profession. We should be able to openly advocate for our professions in a way that it is convincing enough for people to refer cases to us. And another thing I feel is that it shouldn't be based on a referral system where, only when you have a referral, you come to an OT. OT services should be accessible to people by themselves. Like they feel there is something which only an OT can address, then they should be able to go directly to OT.
Got it, Nidhi. Thank you. So you are basically saying that, yes, it's all possible provided we have a direction towards what we should do. And a system already in place, like how a doctor learns or studies medicine, and after he graduates, he knows whether he should get into IMA, whether he should get into a hospital, and the way in which he can have his career trajectory in practice or research or going further for studying or teaching medicine. Similarly, you're trying to say that there should be a system in place that will advocate as well as provide an opportunity for occupational therapists in India to get into the system and then work for the system, if I'm not wrong.
Absolutely.
Are there any other thoughts on this? Are we actually advocating for occupational therapy in India, or do you think it's happening only with respect to IOTA or any other organizations? And do you think people are bothered about themselves? They're not bothered about the profession as such? Karthik, you are muted.
Hi, I saw Murali's hand up there. So if you want to ask his perspective before you move on to the next question.
Yeah, sure, Murali, please. Murali? Even Mani sir isn't. Mani sir, please go ahead.
I'm just about to say about the question that you were asking in terms of are we being self-centered rather than being, profession oriented or professional development oriented. I think the simple answer is I need to fill my tummy first before I can start serving people. So I don't think it is fair to even ask that question, because a lot of us are finding it a bit difficult to think beyond our own selves and neighborhood and things like that. But having said that, it is quite important that we probably need to be looking into what else can I do to improve the profession as such. After listening to a lot of people talking today, which is very, very interesting and very nice of them to express their opinion, if I can actually say a lot more seem to be of venting, which is probably very much needed. But at the same time, what else could we do to make things a bit better? And I think if we can actually look in terms of solution-oriented professional development, it might probably be a bit more useful to us. Don't ask me if I have an answer for it. I don't have one, unfortunately. I'm old enough now, and I left the country for my own tummy, as I said earlier, several years ago, and I have no idea what the current practice is. But a lot of young blood there who are probably having a lot more of vision, much better vision than what I have now. So I think it is important we gather their viewpoints.
Absolutely. Thank you, sir, for that valuable session. We have a very...
Hi, sorry, can you hear me?
Murli, can I get back to you for a minute? So
Please, yes.
It's just in line with what Mani sir was saying. So he was actually handing over the baton to the young occupational therapy graduates and experienced OTs in India now. So we have Lakshmi Narayanan, who is an experienced OT. So Lakshmi Narayanan, do you want to share your thoughts as well, in addition to whatever you're wanting to say? Lakshmi Narayanan? Yeah, your mic is muted. Can somebody unmute his mic, please? By the time that's done, Murli, please go ahead with what you wanted to say, please.
Hi, this is in line with what Jyoti was talking, and I also spoke about it. Then Benny spoke. There is something that we need to seriously see. As OTs, we have always been kind of not happy with, including me. I was not happy with my seniors, what they did in the sessions. And as Benny also said, some of the seniors, of course, yes, still follow the old protocols and old ways of doing. Nothing wrong in it, because that is how they have been taught. We have been taught. Only thing is, it is up to us now to take a call, take the baton, and go forward. As you said, I chose not to go abroad, even though I had a chance, because I decided I have to be here. And then some of them have decided to go abroad because they pursued their own dreams and their own goals to do. So there is nothing wrong and right in where you are going, how you are going, but your passion for your love for the profession always there, but in different directions. That's the only thing. Now, I love the way how Benny is working. I have had a great opportunity to chat with him also. And there are lots of other younger ones, who pursue their dreams in different areas, who does well in critical care, there is one person who is working in Himachal Pradesh with a mobile van therapy service system. Like, she's doing good. I don't think she's doing for money, but she's doing good for that place where there is no OT is going. So how we want to establish hereafter, how we want to reach out to the places or services which has not been tapped before, it is up to us. And as seniors, it is up to us to tap that skill and encourage the younger ones to reach out to those places. It's up to the seniors like us to really push them well.
Right.
Thank you.
Thanks, Murli. Lakshmi, can you unmute yourself and then try? Because I see Karthik saying he's already done it. So you have to do it from your end.
So Lakshmi, I can when I hover over, I can ask you to unmute. So I asked you several times, and also if nothing appears on your screen, go ahead and press your space bar and keep it pressed and talk. I think that will also unmute you. If you press the space bar and keep it pressing and talk, that should help you.
Okay. By the time Lakshmi comes in.
So whenever you get unmuted, you can go ahead and talk. So if you want to
Sure.
move forward.
So the kind of the questions that's come up initially, and now what we are talking about is, so we initially spoke about availability, then accessibility, and within availability we spoke about appropriateness, and after that we spoke about quality, and now I would like to actually delve a little bit into what kind of acceptability is there for occupational therapy services among people who need it. I'm not just talking about parents of children with disabilities. I'm talking about people who want to learn OT, people who are already in occupational therapy wanting to learn more in their post-graduations or higher education or doctoral degrees. So it's not just about are we accepted, or how do we actually feel accepted as an OT in our community? Please post your thoughts, or even kind of if somebody has got the option, or if they want to unmute, they can. Yeah, Lakshmi, we can. You have shared your screen as well.
Host is not allowing participant to unmute. No, I'm allowing everyone to unmute themselves. All right, so let me go ahead and try one more time, because Lakshmi, can you stop sharing your screen?
Hey, actually, it is
Because
getting unmuted for us. I think probably he has a difficulty, because I can unmute myself.
Yes. Yeah, I think everyone is unmuting and talking. So it is, if the host disabled everyone to unmute, then nobody should be.
So Lakshmi, may I request you to kind of post your thoughts in the chat box so that we can take it forward and then discuss. And in the meantime, as I asked, so how do you feel accepted in the community? When I say community, it is more to do with people who need your service and people who are from your own background, occupational therapists from the same state or district, or people who are occupational therapists but abroad working, and then you want to be supported by them or accepted by them. Any thoughts? Does anybody want to talk about it? We have few participants who didn't actually speak. We have Pooja, we have Namagiri Lakshmi.
I think, Suresh, I think we can go ahead and reiterate the overall question for the meeting. Let me quickly read out the question from the flyer that we developed, right? And then just kind of ask everyone, because they're here to share their perspective, and I really appreciate their perspective. So what I'm going to do is, give me 1 second, because so that we just can align with what we said in the flyer. So what must be done as a priority to resolve OT workforce shortage and develop OT workforce in India? So that is a guiding question for this entire session. So if you all want to go ahead and those who haven't had the opportunity yet to talk about this, from their perspective, we would love to hear from you. And over to you, moderator.
Yes, if there's any thoughts on what Karthik just asked, anybody wants to share your thoughts on it? Do you want to speak that or say that question again, Karthik, please?
Okay, so what must be done as a priority to resolve OT workforce shortage and develop OT workforce in India? So that is the guiding question for this entire chat session. So if you really think what we should do as a priority to resolve the existing workforce issues and what we should be doing in order to develop OT workforce in India.
Yeah.
So if those of you, Gomati, Pooja,
I think Lakshmi.
Why can't we hear
left,
from
right?
Pooja?
Some
Yeah.
of them have left, so no problems with that.
Pooja,
hello,
Pooja,
sir.
would you like to go? Hello.
So basically, I guess I answered this question in the last Saturday chat, but maybe if the participants are different, I can give a re-answer to the same thing. So one is the discrepancy in the presence of the workforce. So say for example, we have too many therapists in Mumbai, but we have nil therapists in Gujarat, all over Gujarat. Like you have hardly, the ones you can count on your fingers. Okay, then you have really poor number of workforce in the east of India. You have majority in the south. So if you analyze the discrepancies because of the presence of the number of colleges in those states. Okay, so if you look, we have 16 states out of 25, 26 in India, of which only 16 states have OT colleges. Okay, and again, the number of colleges in each state is different. Okay, so first, we should actually try to cover each and every state, or at least the states which have lesser number of colleges, we should try to increase the number of colleges. So maybe we should have even if there are less number of workforces in those areas, but if we have a college, there would be an awareness in that particular state, and that should be our prime target, be it private colleges. Maybe as we have to anyways get it the syllabus affiliated with the WFOT, so the quality would, I guess, would not be hampered. But yes, we should try to get things. Second is Murli spoke about that we need to mentor each other. Like that concept is not there in India. Even the survey that I did last year, hardly 10% of the therapists in India believe in mentorship and are doing mentorship. Okay, so if we can, each one can teach one. Okay, the quality of OT would definitely be better, and there would be more people who would be interested in getting into OT because the quality is better. I mean, the people would be aware of our quality. See, most of the times now, I have a clinic of 12 years. I mean, so, now most of the time there are many people both in mental health and pediatrics come directly to me. But it is coming directly to me. It is not coming because I'm an occupational therapist, is what I sometimes feel. Okay. So I need to, advocate on that quality. That okay, it's an occupational therapy, the mental health, I'm not a psychologist, I'm a mental health occupational therapist, and this is where I'm making you productive, financially productive and independent that way. So this is how I'm working through a project, I'm working through an activity with you, even if you are coming to me for mental health issues. Okay, so something like that. So if we can get that, so now many people in Mumbai are aware of occupational therapists. They want their children. Secondly, what I generally do is that those people, especially the ones who are in 12th and 11th, they want to come over to my clinic to observe that how or what does an OT do. Okay, so I keep those things. I open my clinic to 12th standard students to come and see. Okay, so if that can also be done by many of the practitioners, that see, because I took OT because I have seen one clinic before I joined OT, and I was happy with the kind of work that was being done. So in spite of my good rank, where I could have got into dental or even physiotherapy, I choose OT. I choose OT. So it's what I always tell whoever comes to my clinic to see. So if that can be done, that can be inspired into our students, we will have many admissions happening.
So just a quick question. When we talk about Mumbai, and we have a council in Maharashtra, right? So what about the rest of Maharashtra? Correct. I know Nagpur has a school, so definitely there will be more OTs there.
Correct.
Yeah. What about other parts of Maharashtra, rurals and suburbs?
See, other parts of Maharashtra do have occupational therapists. They do have government hospitals who have clinical occupational therapists.
Got it.
Okay. Even Akola has one.
Okay.
In fact, one of my batchmates in Akola has started a hospital called Rehab Hospital. Okay. He has a 3-floor hospital, wherein ground floor is OPD, first floor is IPD. Okay. Where for stroke patients, he makes them admitted so that he can give therapy 3 times a day and whatever. So he has got it done.
That's awesome.
So yeah. So and even in that he has one splint unit also. So he makes his own splint. He's an occupational therapist. So I'm very impressed with my batchmate. So, but he also works in a government hospital over there. So there is one government hospital, even in interiors of Maharashtra, where they have one occupational therapist. But they're generally, so I was once talking with him. So he told, I asked him, what's your role? I mean, over there you have, so he is like that over there, they feel that I'm making splints. I work on the hand. okay, and I work with pediatrics. Is what are the 3 areas of mine? But now currently he's working everywhere. He's working even in cardiovascular unit. He's only one currently, but he is working in all the areas.
All the areas.
So heads off to his efforts. I mean, you need those kind of efforts with from a given individual occupational therapist. That is given. I mean, we don't have to say it because now everybody has to do it. It is not a one-man thing. It is not even an association thing. It is at a grassroots level. Everybody has to do it. Every person who passes out as occupational therapist has to know that they have to become independent in their own occupation. Then they can make other people independent in their occupation.
Wonderful.
So,
thank you
yes.
so much. Thank you so much, Pooja.
Yeah, sorry, I can keep going on.
No, that's fine. I just want to hear from Namagiri Lakshmi. Namagiri Lakshmi, would you like to share your thoughts related to the guiding question?
She has actually posted her comment on the chat box, but yes,
okay.
Please, so, we welcome you to speak to us as well, Namagiri Lakshmi.
I just have twins who toddlers and they are just making so much noise. That's why I typed in the chat box. I'm really sorry.
No problem. No problem. Thank you very much for those inputs. It's relevant. So what she says is that if a person who needs any health related services, if they don't see an OT in a hospital, then they are not going to say or learn or at least recognize that there is somebody like that and make somebody else get into that education to learn and then be an OT in India. It's very rare that they see OTs in Indian hospitals and services, which is quite linked to what Pooja was saying as well. We very rarely have occupational therapists in government tertiary care hospitals. We have 600 to 700 districts, as far as I know, 680 to 700 districts in India. We have 35 states, as opposed to what Pooja was saying. So we have lots of people who need us. We have lots of geographical area, and we have lots of primary health care centers that is always there, which are turning to health and wellness centers now, just because of the initial demographic and epidemiological changes that's happening in the country. So we have moved from communicable diseases to non-communicable disease. We have moved from young children more to lots of elderly population in our country. So there's absolutely a need for occupational therapy services available in primary healthcare or even health and wellness centers in all the districts of India. As you all had initially suggested, council could be one key kind of an organization or an institution that can drive to ensure that these changes are happening. I could see Jyoti and Manisha raising their hands, and I'll request them to be quick with their thoughts, and especially because we need to wrap up in some time. Yes, sir, over to you, Manisha and Jyoti.
Before that, Suresh, I think Gomati has posted some message. So if you want to summarize that so that we also hear her perspective, or if Gomati, would you like to go and talk?
Yeah, she was basically seconding the thoughts that's shared by others on standardizing practice, having a mentor who's updated as well, and upskilling is mandatory. So we agree with you, Kumti. Thank you for sharing your thoughts. Manisha and Jyoti, over to you both.
Sorry, it's more of a clarification that I'm looking for. Again, my experience, even currently, not many professionals, considering the leads, the consultants who are probably the leads in service provision in an Indian hospital centers. So I don't see them doing anything at all about occupational therapy. And I'm not blaming them. What I'm looking for is there any possibility of organizations such as IOTA and the likes to contribute towards the medical curriculum, or probably bringing in some understanding of this is what a rehabilitation needs, not necessarily, don't even need to talk about occupational therapy. There are many doctors who have no idea about even physiotherapy for that matter. So I think it is something that we probably need to be bringing that to forefront, and that's all I wanted to say. Yeah.
Sure. Thank you, sir. Jyoti, please. I don't know. Jyoti is not there. Okay, so it basically brings to the last kind of point, which is most important. Not though it's last, it's not very least. Is curriculum. It's about what you learn and what we learn as an occupational therapist, especially to come up with whatever we said as issues to rectify those issues. What do we learn in the curriculum? It's not only about activity analysis, occupational therapy, frames of references, and treatment planning, and looking at rehabilitation. How do we implement whatever we have learned practically in the curriculum is something that's one big chunk, because whatever we learn, we are actually learning from the West. The knowledge is coming from the West, and we don't have system in place in India to implement whatever we learn. So that there is a cost involved in it, and we don't have any system in place to take care of that cost when you talk about any kind of interventions, including OT interventions. But the other scenario is the strategy. So last time when we spoke about this human resource issues, we did speak about curriculum as an important driver to look at human resource and OT workforce development. Jyoti, if you want to actually add on to that point, and in addition to whatever you were trying to say, please go ahead.
Sorry.
After you, I'll kind of ask others.
Yeah, I will make my point very clearly. So we are mainly discussing on how to prioritize our workforce and to develop the workforce in India. So in my perspective, I would say like the workforce is a crucial department. So we need to have a strategical planning, and we need to set our priorities. We need to execute the strategies that we plan, and we need to work on it and to develop to further. So this is a several stage process, and like a multi diverse country like India. So the main thing I would say is we need to work on partnerships. So as a healthcare professional, we need to embrace partnership, working with other healthcare professionals and other departments like council, which means like a municipality or other government organization. And particularly, we are working more in pediatrics, so we need to build a partnership with educational department and the ministries associated to them. So by building this partnership, we can improve workforce. Like the previous speaker Pooja and Nami mentioned in the chat box. So the, for example, building a partnership with the education means we need to give the option for the higher secondary students to observe occupational therapists practicing, which is happening in the Western countries here, where they have a transition year where the higher education students will go into OT practice or any hospital practice to see what they need to do further. So this is something that we need to do to develop the workforce, so that there will be more people buying into do occupational therapy and also to improve the profession. Like Nami mentioned, yes, every patient coming into hospital should see an occupational therapist, or the majority who are coming into hospital should get some kind of service from an occupational therapist. That will be the best way that this workforce will develop, and also we need to have a very good backup from the politicians or the government who makes everything possible. So that would be my humble point here.
Sure. Thanks, Jyoti. So I would basically like to wrap up whatever we've discussed so far, and also kind of, I'm very glad that this has led to another topic that we might have for our next Saturday night session. So we spoke about not just the accessibility issues in terms of availability. So we did not say that occupational therapists are not there in India. We spoke a little bit about that, and the pros and cons of having the number of occupational therapists in India, what could happen in the future and things like that. We also spoke a bit about appropriateness of occupational therapy services delivered by the existing occupational therapists in India. We spoke a little bit on quality of life and how, as an OT, we should look at quality of life as an endpoint or outcome with our services when we render our services to people who need us. And we also spoke a little bit about acceptability of our services. And we also delved into a little bit on the strategies to look at addressing the issues that we have currently. And when we spoke about it, there were lots of solutions that came up in terms of raising awareness, in terms of recruitment, in terms of inclusion of OTs in hospitals and healthcare facilities, and in terms of an individual's enthusiasm and motivation to do whatever they want to do in an area where the services are not available. Overall, when you look at it, it cannot be driven by an individual. We know that because India is a big country, and we have different states, we have different policies, and we have different departments, and we are not there as an independent autonomous profession. And you all said you are expecting a council, and a council is what you all expect to come up with and then radically revolutionize the way in which we develop as well as kind of groom the human resources or OT workforce in India. That's where we ended. And the point that I wanted to share in relation to whatever you have helped us move forward with the next Saturday night session is related to curriculum. Thank you for that. It's not a very easy as well as a very kind of a superficial topic to look at. It might actually take us 2 sessions like how we did for human resources as well. So I request Karthik to consider curriculum development and what has to be there for the future Saturday night sessions. And I'd also like to thank him for giving me this opportunity to moderate. Thank you.
Wonderful. Of course, we way past the time because, we started 10 minutes late, but still like those are hanging there. Thank you so much. And I really thank all of you for your participation, both IOTT and non-IOTT members. And, we obviously, this is, I'm working in the US for more than 10 years now. And one thing that I noticed is all solutions or, everything is like started off from a discussion, just like a free flowing discussion. Brainstorming is what led to big policy changes, big changes in the profession, and, led to the growth of the profession. And that's the same concept here I'm trying to achieve is like from IOTT, we want to like facilitate and increase this discussion. And this recording, we hopefully that will stimulate more and more discussion. It's going to be available publicly for anyone who wants to see and, build on their thoughts and stuff like that. So let's hope that, this discussion is a starting point for much more brainstorming and, wonderful solutions. Once again, I thank you everyone for your time, and we look forward to having you in the next Saturday night chat session. Yes, sorry.
Sorry, Karthik, one last point I didn't mention,
Sure.
and I think I must mention to whoever are the participants here. I'm very happy and very, very honored to say that Karthik and myself, as well as with a team of professionals in WFOT, Richard, and also Karen Jacobs, who we all know, I'm sure. We are all working together to look at workforce development for occupational therapy, not just in India, but throughout the world. So please do get in touch with us if you have any interest or passion to do something in relation to OT workforce development in India. And we will also be kind of updating you all with whatever is happening in relation to workforce development in the future. So we are starting off just now. We have a protocol written to do a scoping review on what do we have as OT workforce in the whole world. And then the outcomes of that particular scoping review will inform us the way forward with how do we want to take it forward. But all the participants who are here and all the well-wishers of IOTTT will be definitely informed and updated about what's happening in relation to this in the future. So, thanks, Karthik.
Thank you. Thank you, Suresh, for that. Bye, everyone. Enjoy the rest of your Saturday evening and have a good weekend. Bye-bye.
Thank you all.
I'm going to end the meeting for everyone. Thank you.